Hi students, welcome to NA's Quick Anatomy. The topic for the day is the scapular anastomosis, part of the upper limb module. How to navigate through the lecture. The video runs continuously, but you can stop at any time by clicking on the pause button. You can then continue again by clicking the play button. You can also scroll the video forward and backward. If a question is asked of you, click the pause button, think through the answer, and click the play button to see the answers. Click pause if you want to read through this page. Click pause if you want to read through this page. Click pause if you want to read through this page. The scapular anastomosis. Clinically, this is a highly significant network of muscular arteries surrounding the scapula. It is formed by the branches of arteries that originate directly or indirectly from the subclavian artery, which anastomose with branches of the arteries arising from the third part of the axillary artery. Its importance lies in the fact that it provides adequate collateral circulation to the upper limb in the event of a blockage between the subclavian artery and the axillary artery. Before we begin the study of the scapular anastomosis, it is necessary to study the muscular landscape and the arteries involved in the anastomosis. A. The muscular landscape related to the scapular anastomosis. First, let's remove the outlines of the clavicle and the subclavius muscle. Let's remove the outline of the pectoralis minor. This is the suprascapular notch and the suprascapular ligament. Take note of the three scalene muscles, scalenus anterior, scalenus medius, and scalenus posterior. Here are the three scalene muscles again from the lateral view. Scalenus anterior, scalenus medius, and scalenus posterior. For now, all you need to know is that they arise from the transverse processes of the cervical vertebrae. However, their insertions are clearly seen. The scalenus anterior and the scalenus medius are both attached to the first rib, with the scalenus anterior in front. The scalenus posterior attaches to the second rib. This is the suprascapular notch. This is the suprascapular ligament. The omohyoid muscle, it has two bellies. The superior belly is attached to the hyoid bone. The inferior belly is attached to the anterior surface of the superior border of the scapula, just medial to the suprascapular notch. The intermediate tendon is connected to the clavicle by a fascial sling. Now, to complete the picture of this part of the neck, let's add the outline of the sternocleidomastoid and the trapezius muscle. This is a dorsolateral view of the neck and shoulder. Let's remove the outline of the trapezius and the deltoid muscle. Let's remove the following muscles but retain their outlines: the supraspinatus, the infraspinatus, the teres minor, the teres major. This is the long head of the triceps. This is the inferior belly of the omohyoid. B. Arteries involved in the scapular anastomosis. Arteries from the axillary artery. A. The subscapular artery. B. The circumflex scapular artery. These have already been covered in the lecture on the axillary artery. Arteries whose blood supply is via the subclavian artery. 1. Suprascapular artery. 2. The dorsal scapular artery. And 3. The superficial cervical artery. Let's study the suprascapular artery. Let's insert the outline of the clavicle. Let's insert the suprascapular artery. It arises from the thyrocervical trunk, which is a branch from the first part of the subclavian artery. It passes laterally, anterior to the scalenus anterior and the phrenic nerve. This is the phrenic nerve. Let's insert the sternomastoid muscle. Let's outline the sternocleidomastoid in green and remove the muscle. 3. At the beginning of the course, the suprascapular artery lies posterior to the sternocleidomastoid. Let's remove the outline of the sternomastoid. Let's insert the omohyoid muscle. The suprascapular artery passes inferior to the omohyoid. 5. It dips down to the level of the third part of the subclavian artery. 6. It passes posterior to and parallel to the middle third of the clavicle. Let's remove the outline of the clavicle. 7. It then turns posterolaterally, passing on the lateral side of the omohyoid. 8. It enters the supraspinous fossa by passing above the suprascapular ligament and deep to the supraspinatus muscle. This is the supraspinatus. Let's now go to the dorsal view of the scapular region. This is the inferior belly of the omohyoid. Let's insert the artery. It passes deep to the inferior belly of the omohyoid. 2. It passes posterior and parallel to the middle third of the clavicle. It turns posteriorly on the lateral side of the inferior belly of the omohyoid. 4. It crosses above the suprascapular ligament and enters the supraspinous fossa deep to the supraspinatus. 5. It passes laterally and curves around the spinoglenoid notch to enter the infraspinous fossa. Its terminal branches anastomose with the branches of the circumflex scapular artery. It helps to supply the lateral part of the infraspinatus. What is the spinoglenoid notch? This is a lateral border of the spine of the scapula. This is the neck of the scapula. And this is the glenoid cavity. The spinoglenoid notch is formed by the lateral border of the spine of the scapula and the neck of the scapula. The branches of the suprascapular artery. The acromial branch. It passes laterally and upwards to supply the acromion, the acromioclavicular joint, and the muscles around there. The medial branch, which supplies the lateral part of the supraspinatus. 3. The branches to the shoulder joint. Let's insert the acromion process. Let's insert the outline and the picture of the supraspinatus and the infraspinatus. Now insert the deltoid and the trapezius. Arteries involved in the scapular anastomosis. We have covered the suprascapular artery. Now let's deal with the dorsal scapular artery. The dorsal scapular artery. This is the anterior view of the neck and upper thorax. Let's remove the outline of the sternomastoid. Let's remove the omohyoid. Let's remove the suprascapular artery. Let's insert this artery. 1. It arises from the third part of the subclavian artery, posterior to the clavicle. It runs posteriorly and crosses lateral to the scalenus medius. 3. It passes medial to the scalenus posterior. Let's go to the dorsal view of the thorax. Let's remove the pictures of the following 3 muscles, leaving their outlines behind: the levator scapulae, the rhomboid minor, and the rhomboid major. Let's insert the artery. It arises from the third part of the subclavian artery. It passes posteriorly, lateral to the scalenus medius, but medial to the scalenus posterior. At the superior angle of the scapula, it passes inferiorly, close to the medial border of the scapula. It lies deep to the levator scapulae, the rhomboid minor, cum major, and finally deep to the latissimus dorsi, where it terminates and supplies it. It gives off lateral branches into the supraspinous fossa, the infraspinous fossa, and the subscapular fossa. Those in the supraspinous fossa supply the medial part of the supraspinatus. Those in the infraspinous fossa supply the medial part of the infraspinatus. These branches anastomose with the branches of the circumflex scapular artery to form the scapular anastomosis. Those in the subscapular fossa supply the medial part of the subscapularis muscle and the insertion of the serratus anterior. 3. It gives off medial branches which supply the levator scapulae, the rhomboid minor, the rhomboid major, and branches also supply the overlying trapezius and the skin. Arteries involved in the scapular anastomosis. We have done the dorsal scapular artery. Now we will study the superficial cervical artery. The superficial cervical artery. 1. The superficial cervical artery arises from the thyrocervical trunk, just superior to the origin of the suprascapular artery and posterior to the sternocleidomastoid. 2. It passes laterally anterior to the scalenus anterior, the phrenic nerve, and then the scalenus medius. Let's remove the sternocleidomastoid muscle. Let's insert the trapezius muscle. 3. It passes laterally and runs deep to the anterior border of the trapezius and supplies it. Let's insert the artery in this image. The superficial cervical artery passes posterior to the omohyoid and the sternocleidomastoid. 2. It passes laterally anterior to the scalenus anterior and the phrenic nerve. 3. It passes deep to the anterior border of the trapezius and then breaks up into several branches to supply it. Variations in the origin of the dorsal scapular artery. Let's magnify the area within the red square. There are many variations, but we will only mention the most common one. It originates from the third part of the subclavian artery in around 75% of cases. It originates from the superficial cervical artery in around 25% of cases. Take note that if the dorsal scapular artery arises from the superficial cervical artery, the superficial cervical artery is renamed the transverse cervical artery, and the dorsal scapular artery is called the descending branch of the transverse cervical artery. However, it is essential to be aware of all the variations if you intend to perform surgical procedures in this area. For example, when creating a skin flap from the area of skin supplied by the dorsal scapular artery. A skin flap is a segment of skin with underlying tissue dissected out, with its blood vessels intact and placed on an open wound elsewhere, but nearby, such as the neck or face. The scapular anastomosis. This diagram shows the normal direction of blood from the subclavian artery to the brachial artery through the axillary artery. Now let's also observe the normal direction of blood flow through the following arteries: the suprascapular artery, the dorsal scapular artery, the subscapular artery, and the circumflex scapular artery. Take note that there are anastomosis between the muscular branches of the suprascapular and the dorsal scapular arteries on one side, with the branches of the circumflex scapular artery on the other side. Let's say there is a block in the axillary artery. Will there be any changes in the blood pressure in the arteries that form the anastomosis? The answer is yes. The blood pressure will increase in the arteries proximal to the block, which are the axillary artery, the subclavian artery, the thyrocervical trunk, the suprascapular artery, and the dorsal scapular artery. Simultaneously, there will be a drop in the blood pressure in the arteries distal to the block. These arteries are the distal part of the axillary artery, the brachial artery, the subscapular artery, and the circumflex scapular artery. At the anastomotic interface, blood will flow from arteries with higher pressure to those with lower pressure. Consequently, blood flow from the branches of the suprascapular artery and the dorsal scapular artery will flow into the branches of the circumflex scapular artery. Blood will then flow into the subscapular artery and then the brachial artery. This means that the direction of blood flow will be reversed in the circumflex scapular and the subscapular arteries. Do you think there will be any blood flow changes in the supraspinous fossa between the branches of the suprascapular artery and the dorsal scapular artery? No, it is unlikely because the pressure is equally high in both vessels. Do you think an anastomosis is present in the subscapular fossa? No, a subscapular anastomosis is not found in the subscapular fossa, possibly because the subscapularis is pressed tightly against the thoracic wall, making it difficult to form a collateral anastomosis. Congratulations! You have just finished the study of the scapular anastomosis. Let's evaluate how well you have understood this lecture. Click pause to read through this, then click play to begin the evaluation. How to navigate through the questions. This video will run continuously. When a question is presented to you, click pause to answer the question. Then click play for the answer and immediately pause again to compare your answers. Finally, click play for the next question.